Hello, and welcome to I Got You, your go-to for honest, simple conversations about vision, eye health, and general wellness. I'm your host, Dr. Valarie Jerome, optometrist and total eye nerd. No jargon, no hype, just real talk, grounded in care and expertise. Because your eyes matter, and so do you. This is a space where you're going to feel heard, seen, and supported, and you're going to get some information that you can actually use. So don't worry, I got you. Welcome back. Today we're talking about a condition that can sneak up on people, sometimes as early as their teens or 20s. And often when it shows up as, why aren't my glasses working anymore? Why do my contact lenses suddenly feel wrong? And why does my astigmatism keep on changing? The answer, in some cases, is something called keratoconus. So what is keratoconus, you ask? Well, the front window, or that clear dome over the eye, is called the cornea. Now that cornea, normally it's smooth and round and it's a perfect clear dome. And its job is to focus the light so that you can see properly. But with keratoconus, the cornea slowly becomes thin and bulges out, a bit more like a cone shape. Instead of focusing the light neatly, it scatters the light. And the result? Your vision becomes blurry, distorted, and frustrating. Reading road signs, driving at night, or focusing up close becomes a little bit harder. And here's something important. If you've been told you have astigmatism and your glasses or your soft contact lenses aren't giving you the clarity that you expect, keratoconus could be the reason. Now, I want to share a couple of stories from patients who came to me after struggling with blurry vision that just wouldn't improve. And these are the kind of cases where keratoconus often shows up unexpectedly. I saw a young man. He came to me. He was probably in his mid-30s, but he was noticing that his right eye and his left eye just weren't working together as a team. A few years ago, he got a bug or something flew in the eye in his left eye, and he thought, ever since then, he started covering his right eye and checking his left eye, and he noticed his left eye didn't see that well. And he wanted to get better at his badminton, and he noticed with the blurry left eye, it just wasn't helping. And so he came to me really worried and really concerned and just wanted to know what was going on with the left eye. Well, we did a full examination of his eyes, and I did something called a corneal topography, and we'll talk about that in a moment. But it showed me he had keratoconus. Now, once we diagnosed the keratoconus, we're able to fit him into a special contact lens that will correct his vision, and now his left eye and his right eye see just as good. There was another case of a young woman who came to me, and she had been in soft contact lenses for many years, and she just noticed that the astigmatism kept changing and changing and changing, but the vision didn't get any better. With each change, nothing got any better. She became very frustrated, and she came to my clinic asking for help. So again, I looked at her prescription, I took her history, and we did a special measurement, a map of her cornea, and we found that she had keratoconus. How long had she had it? I don't know, but I know she had it, and we were able to get her again into a proper contact lens to manage the keratoconus and help her see better, and now she can see clearly with contact lenses. Stories like these are why I always tell patients, if your glasses and contacts aren't helping, especially if you've got astigmatism, it's worth getting a full eye examination. Catching keratoconus early can make a big difference. So how does keratoconus happen, you ask? Well, we really don't have one simple answer. Sometimes it runs in families. About 1 in 10 people with keratoconus have a parent who has it too. It can be linked to things like frequent eye rubbing. You've got allergies, you're rubbing your eyes a lot. That mechanical rubbing changes the shape of the cornea. It can also exist when patients who have certain rare connective tissue conditions. But in many cases, it just happens with no clear reason. What should you look out for with keratoconus? Well, keratoconus usually begins in the late teen years or early 20s. I have found it in patients much older, though. Remember, at first, these changes can be very subtle. Mild blurry vision. Straight lines might look a little bit wavy. You may be a little bit more sensitive to light and glare. Your eyes may sometimes be red or irritated. Or again, your prescription, that astigmatism keeps changing, getting higher and higher. The prescription's stronger, and you're still not getting any better vision. Over time, the vision gets more distorted. Glasses prescriptions seem to change every year. And sometimes that change happens faster. Instead of a year's time or 2 years, it's changing in 6 months' time. You might notice that your soft contacts don't work as well, even if you've got those astigmatism correction lenses, those toric contact lenses. Sometimes people can no longer tolerate contacts at all. In advanced cases, the cornea can scar, making the vision even less clear. But here's the good news. Most people don't get to that stage anymore because now we have treatments to slow or stop the disease. So how is keratoconus diagnosed, you ask? Well, the tricky part is that keratoconus can be missed if you're only getting that basic vision screening. A full eye exam with an ophthalmologist or an optometrist is key. They're going to check the curve of your cornea, and they may use special imaging to create a detailed map of the corneal surface. Think of it, those topography maps of the earth, or mountains, you can see the peaks and the valleys. Well, that's what we can do to your cornea. And this test is called a topography. Now, I'm fortunate enough to have one in my practice, and I check everybody with it who comes in for a routine eye exam. It measures those peaks and the valleys of your cornea, a bit like a map. If your glasses or contacts aren't doing the job, especially with astigmatism, it really is worth asking, could this be keratoconus? Let's talk treatment for keratoconus. So treatment for keratoconus depends on how advanced things are, what advanced stage you have of it. Glasses and soft contacts, in many cases in early stages, your regular glasses or soft contacts may still work. There's special rigid gas permeable lenses, RGP lenses, that can be used. So as vision changes, these lenses, they rest on the cornea in a way that provides a clearer focus. There's also corneal rings. Little tiny inserts can be placed into the cornea in a special way with a surgery, and they help to flatten out that shape to improve vision. There's also corneal cross-linking. So this is a treatment that's used to strengthen the cornea and stop it from bulging more. And this has been a real game changer. And also there's corneal transplant, but this is only in the most advanced cases where that damaged cornea can only be helped with being replaced by healthy donor tissue. And here's a tip that can really help for everybody. Don't rub your eyes. Rubbing your eyes puts stress on your cornea and can make a condition like keratoconus progress much faster. If itchy eyes are a problem, then ask your optometrist about allergy treatments instead. So to recap, keratoconus is when the cornea thins and bulges. It causes blurry and distorted vision. It often shows up when glasses or contacts stop working, especially with those who have high astigmatism. But with early diagnosis and today's treatments, we can protect your vision and improve the quality of life. If you've noticed a blur in your vision and your contacts and glasses prescription change is not improving your vision, ask your optometrist to check your eyes for keratoconus. Remember, when it comes to your eyes, knowledge is power and prevention is priceless. Thank you so very much for listening to the I Got You podcast with myself, Dr. Valarie Jerome. Just a little reminder, everything that we chat about here on this podcast is for info and entertainment purposes only. So if something's a little blurry, itchy, or not quite right with your eyes, book in an eye exam with your eye care provider. Take care of yourself and take care of your eyes.